A terrible accident. That's what police think happened when a 15-month-old little girl fell out of a two-story window this morning. Lexi Meadows is at Cincinnati Children's Hospital where she's being treated for a head injury. 9 on Your Side reporter Jay Warren is live there with an update on her condition. Jay?
Well, we've learned that Lexi Meadows has suffered a skull fracture, though she is conscious and alert. So physicians here at Cincinnati Children's are monitoring her brain, because if her brain would start to swell, then they would need to perform emergency surgery to relieve that swelling. It was around 10:30 this morning when 15-month-old Lexi fell from this window down to the concrete below. You can see the screen that she pushed through is still on the ground where it fell.
Lexi's mom went running up those stairs over there screaming, saying my baby fell down the steps, and that's when I knew what was going on.
When her mother, Crystal Sexton, learned that her daughter had fallen, she ran down, scooped her up, and took her to a neighbor's apartment. Police say the little girl climbed onto a couch that was underneath or next to the window, and that is how she was able to reach that window.
It is a living room, and there was a couch that was near the window. And at this point, again, we're still looking into it. At this point, it appears that the child leaned against the screen and fell out the window.
When first responders arrived, the little girl was unconscious, but she soon woke up and began to cry. John Hensley's son lives with the mother of the little girl.
My son and her, they're real good parents. They make sure the kids are all taken care of all the time. If he's working, she takes care of them. If she's working, he takes care of them.
Could this accident have been prevented? We have learned that the girl's mother certainly thinks so. In addition, the American Academy of Pediatrics says that when it comes to falls, children 0 to 4 were more likely to hit their heads and to be hospitalized or die. The Academy says these injuries are an important pediatric public health problem and that increased prevention efforts are needed, including innovative prevention programs that must be developed and evaluated. In the meantime, everyone is hoping for the best for little Lexi.
We have our fingers crossed, and we really, of course, we all hope and pray for the child's well-being.
Now, I spoke to the boyfriend of Lexi's mom. He says the couple will definitely rearrange the furniture in that apartment when this is all over. Again, physicians here at Cincinnati Children's monitoring her progress. Jay Warren, 9 on Your Side, Coreyville.
Thank you, Jay. This case is a reminder of how important it is to childproof your home. Never leave your baby alone on beds or sofas, even in bouncy chairs or high chairs, basically anything from which they could fall. Use window guards, window stops, and safety netting on windows, decks, and landings, and cut looped window blind cords. Consider using safety tassels and cord stops.